Correction of upper eyelid ptosis is commonly performed with an upper blepharoplasty. So if your actual eyelid margin sits lower than it should or is asymmetric with the other side, I may perform some diagnostic testing in my office to determine if you have true ptosis of your upper eyelid on one or both sides. Once we have that established, if you need to have your upper eyelid ptosis corrected, we can do so at the time of an upper eyelid blepharoplasty. What upper eyelid ptosis correction involves is when I'm doing the upper eyelid blepharoplasty, I'm looking at the muscle and tendon that lifts our upper eyelids up. So when we blink, the circular muscle around our eyes closes our eyelids. Then it's our levator muscle that lifts the eyelid back up so that you can see. It's sort of like the garage door opener for your upper eyelid. Now, when you develop ptosis on one or both sides, it is usually because the cartilage part of your upper eyelid has pulled off of the tendon of that garage door opener. So when I'm doing your upper eyelid blepharoplasty, I can repair this by suturing those two pieces of tissue back together and shortening the tendon of the garage door opener so that your eyelids sit at the appropriate level when you're looking straight ahead. And that is upper eyelid ptosis correction. Now, I prefer to do this if you're awake, because if you're awake, what I can do is I can set the tension a little bit more accurately. I'll have you sit up and look straight ahead, and if your eyelid's sitting a little bit too low still, I'll tighten up those sutures a little bit more to lift it up to the desired location. It's a very dynamic and variable process, so it's helpful to perform this portion of the procedure with you awake so that we can put the appropriate amount of tension on that levator muscle. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.